Hello everyone, friends. If you're watching my videos on myofascial syndrome and trigger points, remember that I always say that trigger points are, of course, just trigger points. They're definitely the cause of body pain, but if you don't restore your body's optimal biomechanics, fighting trigger points will be a constant struggle, a Sisyphean task. And in this video, I want to talk to you about proper posture and how poor posture affects the health of muscles, fascia, the spine, organ systems, and individual organs. Before we get into postural issues, let's figure out what proper posture actually looks like. As you know, humans have 4 spinal segments, and the lumbar and cervical regions have a physiological lordosis, while the thoracic and sacral regions have a physiological kyphosis. Normal posture is a body position where a virtual vertical line passes through the following points: the external auditory canal, the middle of the shoulder joint, the greater trochanter of the femur, and the lateral malleolus of the ankle. Most often, in our age of computers and smartphones, instead of that posture, we see this where the head and shoulders move forward, and thoracic kyphosis increases, and the lumbar and cervical lordosis flatten out. You can check your posture against the wall. To do this, walk up and stand with your back to the wall. Press your heels, glutes, shoulder blades, and the back of your head against it. If this position feels comfortable and easy, then you're close to having proper posture. But if this position feels unusual, then you likely have postural issues. If your head is shifted forward, your neck muscles, fascia, intervertebral discs, and cervical vertebrae are under immense strain. The average weight of an adult's head is about 3 to 5 kilograms. Every centimeter forward increases the load on the cervical vertebrae by 1 to 2 kilograms. Look at this diagram where the left shows proper sitting posture with the head's weight evenly distributed on the cervical vertebrae. And on the right is poor posture, where, as a result of the head shifting forward by 6 centimeters, the load on the cervical spine increases 5-fold, reaching 18 kilograms. If you're bothered by head and neck pain or herniated discs in the cervical spine, there's a 99% chance you have forward head posture. Let's figure out what the normal head position actually is. The cheekbone should be aligned with the manubrium of the sternum. If the distance is less than 6 centimeters, it indicates a loss of cervical lordosis, which happens with injuries to this part of the spine. A distance of more than 6 centimeters indicates forward head posture. This causes severe shortening of the upper trapezius and the splenius capitis muscle, and we also see shortening and overloading of the sternocleidomastoid muscle. Besides overloading the front neck muscles, forward head posture causes stretching of the external muscles in the atlanto-occipital joint area. This increases the risk of compression pathology in this segment. In forward head posture, the suprahyoid and infrahyoid muscles are stretched, transferring extra load to the lower jaw. Therefore, the muscles that lift the lower jaw contract reflexively and are in chronic spasm, which increases intra-articular pressure in the temporomandibular joints. As a result, temporomandibular joint dysfunction can develop first, followed by arthrosis. Forward head posture is the main cause of long-term existence and recurrence of trigger points in the chewing muscles, neck muscles, and the entire upper shoulder girdle. In an incorrect sitting position, long-term shortening of the pectoral muscles, overstretching of the middle trapezius, weakening of the abdominal muscles, and disengagement of the lower back muscles causes back pain and leads to the loss of physiological lordosis in the lumbar spine, which can lead to a hernia. Moving down the body, we see that due to poor posture while sitting, there is long-term shortening of the iliopsoas muscle, weakening of the gluteus maximus, dysfunction of the sacroiliac joint, and shortening and overloading of the hamstrings and calf muscles. I hope I've managed to show you that restoring correct posture to regain, maintain, and strengthen health is a primary task, and it should not be lightly ignored. In the next video, we'll talk about how to sit correctly, but in this video, I want to give you some simple recommendations regarding correct posture in an upright position. Clearly, it's hard to control everything at once. The position of the crown of the head, shoulder joints, arms, pelvis, and legs. That's why many people fail right here, trying to control everything at once. My recommendation to you: perform just 3 exercises that will help you remember correct posture. First, regularly throughout the day, go to a wall and stand with your back against it. Drop everything, because nothing is more important for health than correct posture. The second exercise, when you're not near a wall, focus all your attention on the lower thoracic vertebrae where the lower part of the trapezius attaches to the spine, and try to make a slight forward arch in this segment. But not just forward, but forward and up. And the third exercise is controlling another point in the area of the manubrium of the sternum. Try to reach upward with this point. When you lose this point, hyperkyphosis automatically forms and the neck muscles become overstrained. When this point is under control, the head and neck automatically take the correct position. When setting up correct posture in a standing position, you shouldn't pull your shoulder blades together too tightly, as many suggest. You can perform a simple, basic test. Try to pull your shoulder blades together as much as possible and take a full, deep breath. Exhale. Now relax your shoulders, release your shoulder blades, and repeat the deep breath. And a calm exhale. It's obvious that in the second case, the chest isn't blocked and the lungs work fully. Therefore, pulling the shoulder blades as close as possible to the spine is incorrect. Another mistake people make when building correct posture is the wrong hand position. When the elbows face inward and the thumbs are turned in, it naturally leads to rounding of the upper shoulder girdle and the formation of excessive kyphosis with a forward head position. So, the correct hand position is when the thumbs face forward, the palm is toward the pelvis and hips, and the elbows face back. From all the above, it becomes clear and obvious that if a person is just starting to care about forming correct posture and also spends a lot of time at the computer, then the spinal extensor muscles need extra help. There are a huge number of exercises that can strengthen the deep back muscles, and now I'll show you a few simple exercises related to the topic of this video. Wave-like movement of the spine while performing the cat pose. Here, all segments of the spine and all muscle groups work synchronously. It can be used as a separate standalone exercise as well as the warm-up before performing others. Perform this sequence for 1 to 5 minutes in sync with your breath, arching back on the inhale and on the exhale, stretching the chest up, tucking the chin, and pushing the pelvis forward. And your body will say a big thank you to you. Half bridge. Lying on your back, bend your knees, feet hip-width apart. On the inhale, push your pelvis up. Hold this position for 1 to 2 minutes. A more difficult version with support on the hands. Try to pull your shoulder blades together intensely, engaging the middle trapezius and rhomboid muscles. Hold this position for 1 to 2 minutes. Lying on your stomach position. Place your hands in front of you, lengthen your spine, and position your lower ribs as far from the pelvis as possible. On the inhale, lift your straight legs, toes pointed, feet together. With the exhale, lift your arms, stretch in both directions, tilt your head, and make sure not to overstrain the neck muscles. Hold for 1 to 2 minutes. A more difficult exercise with a hand grip on the shins. Dhanurasana. Place your hands in front of you, lengthen your spine, and position your lower ribs as far from the pelvis as possible, similarly to the previous exercise. Grasp your shins from the inside with your hands, and as you inhale, try to lift your legs, avoiding any strain on your lower back. Hold this position for 1 to 2 minutes. Another excellent exercise for stretching the chest muscles and strengthening the extensor muscles is the bridge pose, or, as it is called in yoga, Urdhva Dhanurasana. However, this asana requires some prior preparation. If you have issues with your lumbar spine, you definitely shouldn't start with this one. A great help in stretching the chest muscles and working on the shoulder girdle can be working with a simple stick or a towel. Take a shovel handle and try to raise your arms up, moving them back as much as possible. If your shoulder joints lock up and pain occurs, then take a longer stick and use a wider grip, or just go to the level where significant discomfort begins to arise. You can improvise and add side bends, twists while stretching, and other exercises. Thank you for watching this video and for giving me feedback in the form of likes and comments. Share the video with your friends and check out my other videos. I wish you excellent well-being and correct posture.